This video explains the main steps to drain the pleural space of a patient with an indwelling pleural catheter, also known as a PleurX. The detailed protocol of the procedure is available on the MUHC intranet in the Policies and Procedures section. Search in the alphabetical section Drains. Always use the PleurX material, devices, and access kit to connect to the catheter. Otherwise, damage to the valve can occur and cause complications such as pneumothorax, infection, or catheter dysfunction requiring its replacement. You will need a lockable drainage line kit PleurX, a negative pressure bottle, a minor dressing tray, sterile normal saline solution to clean the insertion site, 1 pair of sterile gloves, 2 alcohol 70% chlorhexidine 2% swab sticks, and 5 alcohol 70% chlorhexidine 2% swabs. The PleurX lockable drainage line kit includes the following: a blue sterile field of packaging, 3 sterile alcohol swabs, 1 pair of sterile gloves, a PleurX lockable drainage line with a white roller clamp, a 5-in-1 adapter, a PleurX valve cap, a blue emergency clamp, a pre-cut foam compress, 4 sterile 4x4 compresses, a semi-permeable transparent dressing. Before doing the drainage, wash your hands. Wear your PPE if the patient is on isolation. You need to wear at least a surgical mask and ocular protection because there is a risk of splashing pleural fluid when you disconnect the drainage line. Perform the double identification of your patient. Explain the procedure to the patient. Take vital signs. Assess your patient's pain. Ensure privacy. Close the door or pull back the curtain. Position the patient comfortably. Clean work surfaces. Leave the oxygen saturation sensor in place. You will need it to monitor oxygen saturation during the drainage. Open sterile supplies on a sterile field. The minor dressing tray, the PleurX lockable drainage line kit, and the negative pressure bottle. Don non-sterile gloves. Partially open the alcohol 70% and chlorhexidine 2% swabs and swab sticks and place them on the side of the table. Remove the old dressing and examine the catheter, the insertion site, the sutures if present. Sutures are usually removed after 2 weeks. The polyester cuff must not be visible on the surface of the skin. If the skin is visibly soiled, use a normal saline and dressing tray supplies to clean the skin. Allow to dry completely or pat dry with sterile compresses. Take an alcohol 70% chlorhexidine 2% swab in each hand and clean the catheter from the skin to the cap. Touch the catheter only with the swabs and not with your gloves. When you reach the cap, remove the old cap and scrub the valve for 15 seconds. Make sure that once you have cleaned the catheter, you do not touch it with your gloves. Continue to hold the catheter valve with an alcohol 70% chlorhexidine 2% swab using your non-dominant hand. Take an alcohol 70% chlorhexidine 2% swab stick and clean the skin vigorously with friction for 15 seconds in one direction, turn the swab over, and clean for 15 seconds in the other direction. Clean a surface of 10 centimeters by 10 centimeters with the first swab stick. Take the second swab stick to clean the rest of the surface. You need to clean an area larger than the size of the dressing. Be careful not to pull the catheter. Do not remove crusts or scabs. Gently bring the sterile field closer, holding the edges, and drop the catheter onto the sterile surface. Remove non-sterile gloves and perform hand hygiene. Don sterile gloves. Prepare to connect the negative pressure bottle to the PleurX lockable drainage line. Remove the bottle from the plastic wrap. Make sure the white clamp is closed. Ensure that the negative pressure indicator is at the max. Remove the tubing already connected to the negative pressure bottle and discard it, as it will not be used. Take the PleurX drainage line. Close the white roller clip. Connect the drainage line to the bottle. Make sure the negative pressure of the bottle is intact. Insert the drain line access tip into the catheter through the valve until a click is felt. Lock the drainage line in place by rotating the access tip until you hear a second click. This will secure the connection between the catheter and the drainage line. Open the white clamp of the bottle. Gradually open the white roller clamp of the PleurX drainage line. Pause or slow down the drainage rate with the white roller clamp if the patient coughs, feels short of breath, or mentions chest pain. If clamping is required, reassess after 1 minute and slowly resume the drainage if symptoms have improved. Stop drainage if one or more of the symptoms reoccur, the maximum amount of drainage ordered is reached, usually 1 liter. There is no more fluid to drain. Pleural fluid can be clear, cloudy, thick, or with white clots. The color ranges from serous, whitish, yellowish, brownish, or sanguineous. When drainage is complete, close the white roller clamp completely. Unlock the drainage line access device by rotating it in the opposite direction. Remove the drainage line. Scrub the valve with the sterile alcohol swabs included in the Pleural kit for 15 seconds and let dry. Place a new sterile cap, turning clockwise until a click is felt. Place the pre-cut foam compress around the catheter insertion site. Wrap the catheter and place it on the foam compress. Do not tie a knot or bend the catheter because it will damage the catheter. This will allow the catheter, including the valve, to be completely covered under the dressing. Cover the catheter with 2 sterile 4x4 compresses. The catheter should not be in direct contact with the clear film dressing to prevent accidental dislodging when removing the dressing. Apply a transparent film dressing. Keep the blue emergency clamp at the bedside or give it to the patient. It is only used if the catheter or valve breaks. Discard equipment and clean the work area with disinfectant wipes and let dry. Discard body fluid in appropriate waste container. Remove gloves and perform hand hygiene. Document vital signs in OASIS or MedUrge. The FOCA assessment of the pleural drainage documentation form, MD 2569, or in the in and out sheet in mid-urge. Treatment tolerance or any side effects in progress notes using the DARP documentation method.